So I'm going to introduce our first speaker this morning. Her name is Dr. Dana Helmink. I'm going to give you a little bit of background. She earned her Master's of Arts in Audiology from Northern Illinois University and her Doctor of Audiology from Salus University. She worked in clinical audiology in Illinois, where she also served more than 15 years on the board of directors of the Illinois Academy of Audiology. Dana applies her experience in user-centered design to develop innovative training programs that make it easy for professionals to embrace new technology and to provide patients with access to the best hearing care solutions. Dana is the author of many publications and presentations on the topic of signal processing and sound quality and amplification. And she's currently serving as the Senior Director of Audiologic Development with Widex. Please give Dana a warm welcome.
Thank you. All right, good morning. Let me just move, I think, the microphone here. Yeah, we'll make it work. You can hear me okay? All right. Good morning. I'm happy to be here. Hello to everyone in the room. Hello to everyone online. If you're in the room, you'll have the unique pleasure of watching me struggle to stay behind the podium. I'm a bit of a wanderer when I present, but it makes life difficult for the cameraman, and with a handheld mic, your life would be in danger as it goes potentially flying out of my hand when I get a little bit, animated. So I'm going to try to stay behind the podium and not injure anybody right here at 8 a.m. this morning. So as introduced, I'm Dana Helmink. I am with Widex, but today I'm really talking to you about a lot of non-Widex things and an exciting topic that comes out of some of the research being done by WS Audiology and our overall research group. And that topic being empowerment and the role of empowerment in that hearing healthcare journey. So again, there's me, younger and with better hair. But, so now you know what it could be like. You didn't get that Dana, you got this Dana today, so bear with me. And also, I'm here all week. The comedy act goes on. No. So speaker disclosure, as I said, I am with Widex, so I do have a relevant financial relationship with Widex and with WSA. They are kind enough to compensate me for my efforts. No non-financial relationships to disclose. And I also have to try to not let the computer slide off the podium. So, all right, learner objectives as submitted for this presentation. After this course, participants will be able to define both the process and state of empowerment along that hearing healthcare journey. You'll be able to describe the relationship between empowerment and successful outcomes in hearing care, and you'll be able to describe methods to assess and improve empowerment pre- and post-treatment in the clinic. And that's probably my favorite part of this talk, is sharing with you some new and emerging research and opportunities for how we can evaluate empowerment, how we can measure it, how we can start to have more quantified and meaningful conversations about empowerment, and then at the clinic level, what can we do? What can you take home today and potentially start doing, next week in your clinic? So again, agenda, some of the things that we'll talk about, maybe not specifically in this order because I'm not good at going in the order that I say the agenda will go in, but the importance of empowerment in healthcare overall, and then looking specifically at that hearing healthcare journey and what we can do to how empowerment is unique in that journey and in that arena. Empowerment as both a process and an outcome, so something we're doing and a goal that we might have. Assessing empowerment. Everybody loves a new tool for measuring something, and so I get to introduce that to you today. and strategies for developing empowerment in our patients, and then maybe in ourselves. I always think any good topic can potentially be applied not only in your lives as clinicians helping those with hearing loss, but in our own personal lives, and how do we pursue empowerment for ourselves in our own healthcare endeavors. So I'm going to start. I know we have people in the room and people online, and I'm not, and we're going to like hold questions to the end, but let me also say that if you just have a burning question, go for it. I'll repeat the question into the microphone so that everybody online can hear. I can't stand the thought of you with this question for potentially an hour and a half, and then maybe not being able to hear anything I say after that because of that question on your mind. And additionally, because I'll ask some questions and I'd love it if somebody answered. I had a graduate school professor who would ask a question, and when nobody answered, we would just wait, and then she would keep us late. So you don't want that scenario. So if I ask for input, just shout it out and I'll repeat it from the microphone. Do we have a deal? Sure. Okay, all right. Okay, so what does empowerment mean to you? Throw out some words for me. What does empowerment mean to you?
Strong women.
Strong women. Strong women, I heard. More?
Self-advocacy.
Self-advocacy. You're testing my hearing today. Anybody else? Thoughts? No? That's it? Okay. All right, what does empowerment mean? Those are right answers. Actually, there's a lot of right answers. The interesting thing that I found as I did some of the research behind this and looked at some of the research being done by our organization is that sometimes empowerment is not a well-defined term. It's a little bit fuzzy. What do we mean by it? What is it? What is the definition of it? How does it come to play in clinical practice? So probably whatever you're thinking in terms of empowerment is the right answer, since it can mean a lot of different things. So confidence, independence, right? The ability to do what we want to do in our lives independently. Participation is a theme that interestingly comes out a lot in discussions around empowerment. I think as audiologists and clinicians tend to think of social participation, but there's also the participating in your own healthcare, the participation in making your own plan, seeking solutions, being an active part of the care that you receive in any kind of healthcare environment. Control, right? So feeling like we can influence the outcome of something, that we have control in our lives, and engagement, right? Being engaged in finding our own solutions for our healthcare, engaged in a treatment plan for that going forward. And just a comment here too, with the exception of maybe a couple slides I wouldn't be able to share. I'm one of the people, I will share slides, so you can relax, you'll get all of this, but also if there's something that inspires you, you can take pictures with your phone. All right, so the World Health Organization has looked at empowerment and has recognized it as a process through which people gain greater control over decisions and actions affecting their health. And they note that this should be seen as both an individual and a community process, right? So there's the individual sense of empowerment, and then there's empowerment that might be grown and fostered within a community, within the healthcare arena. This involves recognizing and respecting the autonomy of patients, providing them with necessary information, and supporting them in making informed decisions about their care. Oops, sorry, wrong button. So empowerment in healthcare can be broken down into a few key aspects. Patient education is one theme in empowerment that comes up often, providing patients with the knowledge they need to understand their health conditions and their treatment options. Shared decision-making, so encouraging patients to participate actively in decisions about their care. We've really moved away, over the last several decades from what was kind of called the paternalistic approach to healthcare, where a doctor told you what to do and then you did or didn't do it, to be fair, but you weren't involved in a discussion about it. There was no shared decision-making involved. And so that's changed a lot in recent decades. Self-management, supporting patients in managing their own health, especially for chronic conditions. So I think there's chronic conditions that are more part of that self-management aspect now. And also sometimes that entry point into healthcare is a bit more self-managed today. Think about something that you might experience in your own life. If you have a sore knee or elbow, for example, you might start with some Advil, some ibuprofen, some over-the-counter painkillers. Maybe you use a cream. You Google some stuff. You search some things up online, as my teenager would say. When I say Google, she says it dates me. You search it up, Mom. So you search something up online and you find some recommendations. You go through a kind of a journey of investigation of what works for you before maybe entering into a formal process of seeking health care. So that self-management aspect at the beginning, throughout, and then on into managing chronic health conditions. And then patient-centered care, focusing on the patient needs, preferences, and values in aspects of care. Again, everybody here is familiar with that concept of patient-centered care. So really looking at what are the needs of the patient, identifying their needs, getting to the bottom of what it is that has driven them to take action towards whatever healthcare scenario they are pursuing, whatever healthcare need they have. We need to look at what is their driving force, what is it that they are seeking from us in terms of service, and then working collaboratively with them in providing that care that centers around them, as opposed to around a particular prescriptive model of healthcare delivery. All right, so when you look at empowerment research over the recent time, well, maybe not recent, I'm starting in the 70s. I like to say that's recent. Makes me feel young. Social empowerment entered the public consciousness kind of late in the 1970s as something that started to be investigated in various aspects of, kind of public awareness, in community services, and in healthcare. Zimmerman is noted to have introduced a framework for psychological empowerment that still serves as a strong basis for looking at empowerment in healthcare today. And what Zimmerman defined was this definition of empowerment, or this perspective on empowerment, that involves individuals gaining a sense of control over their own lives, and includes aspects like self-efficacy, critical awareness, and participatory behavior. So some of the things we've already touched on. And this concept of empowerment has moved more front and center in the research, in the literature, in the way that health organizations delivering healthcare craft their policies, and certainly with that shift towards a more patient-centered healthcare model, that we see empowerment kind of growing in the attention that it gets. However, despite all of that research, there's actually a bit of a lack of research on patient health empowerment evidence in hearing healthcare. And so there's a need to look at what is coming, what are we offering, how are we using empowerment in hearing healthcare, not just in healthcare overall, so specific to hearing healthcare. So, and what are the outcomes of that, right? So all of this research has been done looking at general health outcomes and general sort of empowerment themes in healthcare overall. And there's some themes that come up there. Empowerment can lead to better health outcomes, right? More efficient use of healthcare resources. So we see that in the evidence. Empowered patients tend to be more satisfied with their care. they feel heard, they feel respected, and that enhances their overall healthcare experience. And empowerment can increase patients' feelings of autonomy, the feeling they have of the ability to self-manage, and their coping abilities for dealing with whatever healthcare condition they're managing. Most of these outcomes have been assessed and measured in other chronic healthcare conditions. Diabetes and cancer, heart disease are a few of the key areas where, because of the nature of those chronic conditions, these studies have been ongoing for a while, looking at empowerment in that, along with the need for individuals to really be active participants in their healthcare when they're dealing with chronic conditions like that, taking their medicine, following diet guidelines, seeing their doctors regularly. So as a result of the nature of those chronic conditions, much of the research was done here. So then the question really came up. Intuitively, we think that the benefits that you see there would relate to hearing loss as well. That it makes sense that hearing loss is a chronic condition, not dissimilar from some of the other conditions that have been studied, and so we should see the same benefits. But it turns out that there's a bit of a lack of research in this area, specific to hearing healthcare. Not a lot of formal research, especially quantitative research, where we've really examined empowerment in hearing healthcare. And so that brings me to what I want to share regarding some of the research that's available. So what you see here represented, because I want to acknowledge all the individuals who contribute to this research, you see the WSA Research Network. So that's WS Audiology. And we have research facilities around the globe, several that are doing applied research in clinical amplification. Those are our Office of Research in Clinical Amplification, or as you see up there, ORCA, one in Europe, one in the US, and a new one in Asia. And then we work with strategic partners around the globe as well. You see many of them listed there, but I'll highlight National Acoustics Laboratory. This has been a joint research venture between our researchers at WSA and the ORCA team and National Acoustics Laboratory to investigate empowerment. There are more researchers not properly acknowledged here, but these are three who you will see are usually first author or are the lead authors on some of the seminal kind of foundational research in this area in empowerment, something that we've been looking at for a while on the research side for our ORCA research groups. So I want to recognize them and be clear, this is not my research. I just have the privilege of sharing it with you and finding that clinical application in it. So it's great when you have strong research, and then we look for how can we clinically apply this in our day-to-day practices. And so that's where I get to step in and meet with and work with these researchers and take their work and bring it to you. So I'll start with a study that is really a first of its kind in looking at empowerment, and it was this foundational study looking at empowerment in hearing healthcare. And what the study aimed to do was kind of look at how empowerment manifests itself from somebody's first awareness that they have hearing loss or might have hearing loss through to becoming an active hearing aid user. So along that entire journey, how does empowerment manifest itself? And then identifying the different dimensions of it at different points along that journey. Is it linear? Is it, dynamic? Is it static, right? So kind of quantifying and defining how empowerment looks across the entire journey. And then conceptualizing empowerment. So can we create a good definition for it? Can we define specific dynamics of it? And can we make a measurable scale, tool, or questionnaire to try to start to evaluate empowerment going forward? So since I mentioned it a couple times, and you'll see it throughout here, it's important that we start with the journey, right? So hearing loss is a journey. Peaks, valleys, it can be a long journey for some, a shorter journey for others. Everybody's journey is different. And so it's helpful that we define that journey. I'll share a personal example of a very long hearing loss journey. I've been an audiologist for almost 25 years. My dad has been a individual with hearing loss for more than 25 years, and I just got him to become a consistent daily wearer of hearing aids this year. So talk about a long journey. The shoemaker's son has no shoes or something like that. It was a challenge, and I might share a few more things as we go through this as an example of why that challenge existed, but certainly about kind of recognizing what his needs were, understanding his journey, finally finding that motivation for him, because it wasn't that his daughter was an audiologist, sadly, versus my brother-in-law, Mike, who said, I have some hearing loss, Dana, and I said, I can help you with that, Mike. And he went and got a hearing test. Turns out he has had otosclerosis, had an amazingly severe hearing loss. I can't even imagine how he was getting along, and put hearing aids on him, and he's worn them every waking minute of every day since the moment he got them, and absolutely loves them. So, the difference in journey can be significant, but the fact is that you can still kind of break that journey down into a few different parts, right? That pre-fitting period, that time when somebody is kind of coming to terms with their potential hearing loss, investigating their options, seeking solutions, hearing recommendations, making a decision. That fitting period, actively, right now, getting hearing aids on ears or whatever the solution is for that individual. Getting them adjusted to wearing hearing aids, and then hopefully a post-fitting period where they become a long-term and successful daily user of hearing aids in the most simplified way. So this concept of a hearing journey comes up a lot in the research, and we look at how empowerment might play in and might be involved throughout the different phases in that journey. But some of the research that was done on empowerment started off with a really simple idea, which was just to define what it is in hearing healthcare. What is our definition of empowerment? And you can see it up there. I'll read it to you as well. So empowerment is the process through which individuals with hearing-related challenges acquire and use knowledge, skills, and strategies, and increase self-efficacy, participation, and the feeling of control of their hearing healthcare, hearing solutions, and everyday lives. So the researchers, after doing interviews with individuals with hearing loss, interviews with hearing care professionals that helped to identify the kind of the dynamics of empowerment, arrived at this definition. And they further share that, the value of empowerment for persons with hearing loss lies in its ability to promote that autonomy, create somebody who's a self-advocate, striving for independence, and achieves societal inclusivity, right? We participate in life, with the ultimate goal of enhancing quality of life and well-being. And I think that's pretty significant. Just show of hands, whose goal when you work with a patient is to improve their quality of life. Yeah, it's kind of the thing we're trying to do, right? So to see that empowerment can be a critical factor in that, not just what we do with hearing aids, not just how we make a recommendation for their hearing loss, for their solution to their hearing loss, but how we can empower them to be that participant in achieving quality of life. And overall, in looking at standard healthcare and then the beginning work on interviewing, measuring, and so on, would indicate that empowered hearing aid users might get more benefit from their hearing care and possibly from their hearing aids themselves. So being empowered produces that better outcome. I think we all know the potential consequences of an unempowered patient, right, for the hearing care, and the consequences not just for the patient, but for us. So for you as the hearing care professional, potentially losing professional time, having tedious appointments that don't produce the outcomes that you want, kind of getting stuck, not getting to move forward with that patient, feeling a little like the hamster wheel there. Frustration due to lack of commitment or involvement from the patient, right? You have ways that you can can help them, but they're not really receiving that information. They're not actively acting on what you're suggesting. And so again, you're sort of stuck in the loop. And of course, potential return of hearing aids and that failure to move them into that phase where they are a successful daily hearing aid wearer, like my dad for all those years, right? So for the wearer, not wearing the hearing aids, if they're unempowered, maybe lack of motivation and time that they invest, and the risk of further social isolation and all of the impact that can come with that. So out of this recent research, what was the key finding was to be able to create this framework for the dimensions of empowerment. So what are the dimensions that we can quantify, classify, and then describe for how we can define empowerment? And then you'll see how we take this on to look at how we can measure empowerment and how we can have conversations with our patients about the idea of empowerment. So from top to bottom here, you see them listed out. Knowledge, the first one. So that's that relevant information on hearing loss and treatment options. So kind of gaining knowledge. Certainly that's a key at the beginning of the journey, but you'll see a little bit how as we go through the journey, there's continued need for knowledge just in different areas. Skills or strategies. So these are strategies necessary to manage the challenges of hearing loss. Participation, this is a little bit twofold. So what came out of the interviews that the researchers did on this topic is that two areas sort of emerge when we look at participation. One is shared decision-making in the healthcare, in those healthcare decisions, in those hearing healthcare decisions, and the other is social participation. And it was an interesting thing they found that how that kind of shifts as the patient goes through their journey, maybe starting off in that decision-making mode and then starting to focus on how participation really is about their social participation in their lives. Control, that's that belief that things that happen in your life are related to your own actions, right? You do something, something happens. You can create an outcome. That is that sense of control. I think, anybody in the room love feeling like a lack of control? No hands raised, right? Yeah, it doesn't make you feel good if you don't know what's going on. And again, you can think of it from your own healthcare things. If you've ever had something going on in your life from a healthcare standpoint that you had to seek medical services, go through diagnostic tests, get answers, see what recommendations are. There's points in that where you can feel it feels very out of control. You're not sure what's happening. So when we deal with chronic conditions, hearing loss being one of them, that sense of control that can be lost related to hearing loss, related to the kind of unknowns and uncertainty of the treatment plan is a theme that really comes up strongly. So I think if we were to look at a really prevalent theme that goes throughout a lot of empowerment research, it would be this idea of control. In fact, it sometimes is defined as the goal of empowerment is this sense of control. But actually, the researchers also found that self-efficacy was a key. So that belief in oneself to be able to do something and manage a situation. So feeling like there will be challenges, there will be things that will come up that will be difficult, but that you are able to handle it, that you have a belief in your ability to manage that situation or that challenge when it occurs. So these are the key dimensions of empowerment. It's what we're going to further investigate and look at how this plays out across the hearing healthcare journey and how you can facilitate conversations with patients on these dynamics and their kind of status around them, because it can be quite varied, okay? All right, so back to that hearing healthcare journey that I put up earlier. But now what I want to do is kind of show you how these, how the dimensions of empowerment that you just saw, how they might play out across the patient journey. So we'll start with knowledge. And you can see these are just examples, not hard and fast rules. Not every patient that you see is going to have an experience at every single one of these kind of points, right? Not every dimension in every phase is relevant to every person, of course, right? We're all individuals. But in that pre-fitting phase, it can be where that dimension of knowledge emerges in those interviews and in the work done to look into this research, is the idea of lacking knowledge, right? Do I have a hearing loss? What is my hearing loss? What can I do about it if I have hearing loss? What are my options, right? So that lack of knowledge. In that fitting phase, sometimes it's the wishing I had known was this theme that came up, right? So maybe there's something they don't know about their fitting, about their hearing solution, about their hearing aids, about whatever it is that they're interacting with, whatever that recommendation is, that feeling like they gain that knowledge later, but then they look back and say, I wish I would have known that when. I could have been more successful if, okay? So that wishing I had known. Knowing where to turn. So in the long run, knowing where to find information, right? So we know that when we share information with our patients, they don't remember all of it, do they? How much, anybody know the number on, and I don't know the answer to this, so it's not a test. I can't remember. What is the percentage that they estimate that people retain from any, what is it? 25%. I was going for 30, so I'll trust you on 25. So yeah, that's a small amount of information that is retained at that initial information sharing appointment that we have with a patient. So knowing where to turn for information throughout that journey, especially in that post-fitting where they have less frequent contact with their hearing care provider, or if you're just thinking of this from the framework of standard healthcare, from your own healthcare, right? Where do you turn for information when you can't remember what was shared with you, or when maybe something changes in your situation? Where do you go for that information? Then looking at skills, right? Developing strategies. So in that pre-fitting phase, individuals can develop strategies. They can sometimes develop some good strategies, but they can also develop some maladaptive strategies, right? Some bad habits. Some of the behaviors around asking for repetition that isn't the most useful way to do it, monopolizing the conversation, talking over people, right? They can develop not good strategies, skills that we have to kind of undo for them. But then also later in that post-fitting phase, we want them to develop skills throughout that journey, and then in that post-fitting phase, look at how they're using skills in the long term, right? So we might go from developing kind of unlearning some bad strategies to learning some new skills and strategies, and then learning to consistently apply those and know when to do what thing. They also identified across this theme of participation, right? Various points along the journey. And you see this is a big one. That means when there's a lot of little bubbles like this, it means that in the interviews that they did with individuals with hearing loss and with HCPs, that these themes came up quite a lot across all points in the journey. So looking at participation, sometimes that lack of social participation being the thing that is driving somebody into that pre-fitting phase to start that hearing care journey. Also, sometimes participation can actually refer to kind of a lack of action. These are really open-ended interviews that they do, so they end up with a lot of interesting input about different ways that participation might manifest throughout that journey. So lacking action, right? Doing nothing, not thinking I have to do anything. Anybody thinking of my dad again? I am. So you're going to really be thinking of my dad by the end of this. I should put a picture of him so you know what he looks like. So he was the lacking action, right? He was definitely seeing some impacts in social participation, but he was really lacking action. It just nothing had motivated him to take part in this, despite the audiology daughter, despite access to hearing aids, right? So he just was lacking action. He wasn't making that decision to get help. You see that in that fitting phase, right? So, and he definitely wasn't participating in his care. So he was just the worst patient ever. But that decision to get help, participating in care, you see that in that fitting phase, right? And then post-fitting, participating socially. So you see that shift of where participation can go up and back between social participation and participation in healthcare. Both themes are relevant because it's just the way that people respond to these themes and these topics in exploring the dynamics and the dimensions of empowerment. Okay. Then looking at control, right? Kind of a common theme is hearing loss sort of affecting that sense of control that somebody might have in that pre-fitting phase. And then again, as I mentioned earlier, we often view empowerment as being something where the goal is hearing aid use related to feeling control and that post-fitting phase where we want them to get to a point where they have a sense of control, and maybe that sense of control is driven by their use of amplification and other solutions. And then lastly, we see that self-efficacy, lacking confidence potentially at the beginning, or sometimes an abundance of confidence that you don't have a problem. So it can go both ways, right? So that lacking confidence in kind of your situation at that beginning, gaining confidence over time, and then ultimately really internalizing that feeling of confidence in the end. And that bottom one is really kind of mapped out in that ideal perfect journey, but it's not always perfect, right? People can move up and back between those feelings throughout their hearing healthcare journey. The thing about empowerment, though, and I think this is super important, is that it is a collaborative effort. It isn't something that the patient just achieves on their own, and it isn't something that you as a hearing care provider can execute entirely on your own. So patients can be empowered through the healthcare provider, giving them access to education, providing counseling, providing patient-centered care, right? Sharing information, making recommendations, obviously meeting their needs. So you have a significant and important role. But if the patient doesn't do their part, if they don't step in with the collaboration on empowerment from them, it's unlikely to succeed. Patients can also empower themselves through accessing self-education, help seeking, joining support groups, advocating for themselves and others. Okay. So we're in it together with them, and we have to find the way to move through that journey and connect with them with where they're at in their hearing healthcare journey, but also on their path with empowerment. So empowerment's a process and an outcome. That's a really interesting thing that comes out of a lot of this empowerment research, is that it's both things. Maybe where we want to go is empowerment, right? We want to be empowered. That's our goal, our end goal. And we might be starting from a place of disempowerment, right? Not feeling empowered. But as we move towards that goal of empowerment, that timeline is not well defined. Some people can move quickly, some people will move slowly, and maybe most importantly is it's not static. You can end up moving up and back in this continuum between disempowered and empowered throughout your hearing journey, even when you reach that post-fitting phase. Things can change in your life. Your circumstances can change. Your hearing can change. How your hearing solution is meeting your needs can change. And so you can end up really moving up and back along that continuum. And so it's with that knowledge that really drove a lot of this research to help us better understand empowerment, how we can define it, how we can ultimately measure it. Because if this is happening, this up and back along the continuum, how do we know where our patients are at in their empowerment journey, right? In their process of achieving empowerment? How do we know where they're at if we're not asking them? and if we don't have a good way of kind of measuring that and understanding what it is that, and knowing where they're at, and then thinking about how do we use that information. Okay. So, this represents a bit of the process, this very iterative process of research that has been ongoing on this topic of empowerment. And again, along the top, it's acknowledging a bunch of the researchers who have been involved, primarily led by ORCA, the research facility for WSA, and National Acoustics Laboratory. They have a joint interest in this theory of empowerment, and this research is ongoing. But here's how it's flowed so far. So at phase one, what was done by the researchers is looking at this concept elicitation and conceptualizing. And so that's what you just saw. All of that work to look into what are the dynamics of empowerment. Then drilling down a little deeper to look into item generation. So how can we ask questions about or have questionnaires or define some of those various empowerment items a little bit like what you saw on this, right? How do we get from here to something a bit more concrete in looking at empowerment? So that was at phase two. In phase three, they went through a content validation. So this is an expert panel of HCPs and a panel of intended population, so individuals with hearing loss. So interviews in both groups that start to look at those items and say, did we express that correctly? When we describe something about the way that you feel about knowledge acquisition, is it valid, relevant? Does it accurately describe your experience? Phase four of that research is what they call item reduction. So they start with a really long list of things, and then as they go through that validation phase, we start to reduce that to something more manageable, because who here in the room likes to give a 100-item questionnaire to your patients live and in person in every fitting? No one? Okay, for the people at home, no one is raising their hand. So we like short, efficient questionnaires. We don't want to do something, lengthy and unnecessary. So that item reduction gets down to the most meaningful elements. And then a psychometric analysis of the final structure. That's where we look for that consistency and validity in the test. It's worth noting that the level of scientific rigor that goes into this type of study is really impressive when done right. It's not easy to create a new questionnaire or a new kind of quantitative measure. There's a lot that goes into it. So, and this is kind of what goes into it and what comes out of it, right? So we have defined these dynamics. You've seen them here. I've talked about them already. I won't read them again. That's what feeds into empowerment. That's what leads to empowerment. What comes out of this research on the other side, like magic, are two questionnaires, the MPAC-5 and the MPAC-15. I'm going to go deeply into the MPAC-5 here in this presentation. It's a 5-item questionnaire that has been developed with primarily clinical use in mind, and it has one question from each of these domains or each of these dynamics here of empowerment. And it doesn't matter if you're what you're fitting. It doesn't even matter if you're fitting anything. This is a questionnaire you can use with somebody who has not leapt into that hearing journey yet. It's a questionnaire that you can use with somebody wearing any kind of amplification at all. The MPAC-15, which I won't spend time on here, is the 15-item test. So it's the result of that kind of item reduction, looking at something, and it's what we can use to do greater test validation, look for retest reliability. It can be a more sensitive measure of things when we're doing experimentation, looking at the impact of empowerment and how doing something might change empowerment. Sometimes you need a more sensitive measure. So it's more research-related, in-depth clinical use, or for those of you who really love 15-item questionnaires in your practice, I won't judge you. It's available. Then it has more like 2 to 4 items from each domain, so it's a little bit more comprehensive. And it has a bit more information on hearing aid use, where the first one eliminates some of that so that it's not at all, and it's not ever any brand specific. The first questionnaire doesn't really get into hearing aid use or device use, and the MPAC 15 starts to touch on hearing aid use. All right. Here's a little bit what it looks like, or at least a portion of it. So this is the MPAC 5. And by the way, if you're looking for this, the URL is there. We'll be sharing the PDF. You can also just search up MPAC-5. It'll pop up. It's freely available, the forms for you to use. And I'll leave that there for just a second in case anybody's grabbing it. But okay. So MPAC 5, you see the questions here. So 5 statements more than questions, really. It's called a questionnaire, so I keep calling them questions, but to be fair, they're statements. So each statement, and then you simply ask strongly agree to strongly disagree to strongly agree, which gives it a numerical rating, or it can also be rated as not applicable. Instructions are provided for, and I'm going to go into each of these questions a little bit more. So instructions are provided for scoring with an example on the form, so you can easily see how to score. When you do the scoring as instructed, you will get a 0 to 100 scale. So a result on a 0 to 100 scale. So if you're interested in kind of measuring empowerment over time and want to have a numerical value to go along with that, it's easy to use in that way. Research is ongoing a little bit at this time to sort of put some parameters onto what those scores look like. So what would you say, what does it mean if somebody has a 70 or a 30 or an 80, right? Like more quantified kind of assessment of that number, and then also looking individually at each question. If you have a certain score in one area or another, is there, and what's the threshold there? So that work is ongoing. So we focusing on this questionnaire now, though, more so for how it can get the conversation started. So I told you there's a question for each of these parameters, right? Each of these domains, so to speak. So, and they go in pretty much that order. Question number 1 looks at knowledge, then skills, then participation, control, and self-efficacy. So going back to that empowerment framework, now we have kind of a starting point for having a conversation with patients about that. And so that first item under knowledge, you can look at the statement is, I know how to help if I have any problem. I know how to get help if I have any problems with my hearing. And then they can give you a rating. And then you can decide what to do with that. Typically, what you're looking for is the person who rates this in a way that indicates that they're not on the path to empowerment with that kind of domain, right? So if they said, I know how to get help if I have any problems with my hearing, and the rating on that, they strongly disagree, that would indicate they do not know how to get help. And so then you have the opportunity to explore this, right? Additional questions that can be asked. What kind of help are they seeking? How can I connect you to the help that you need, right? It starts a dialogue with them. Actions that you can take, and I'm going to go into a lot more stuff about, like, clinically, what can we think about doing? So I'm not going to dive into that here as we go through the actions, because I'll share more information about that next. But the actions that you can take. Right, so connect to a trusted source of information outside of the audiology clinic, right? They don't sit in your office all day. So maybe if they don't know how to get help about their hearing problems, it's because they sometimes need help when they're not in an appointment with you. So how can we get them the information they need? Because remember, this applies to everywhere along the journey. It isn't just the starting point where they may be floundering and think that they have no information. It's also during the fitting phase. It's also during the post-fitting phase. So how do we ensure that they have access to information throughout that entire journey? So our action that we might take on this is to explore the kind of help that they're seeking, how we can, how I can connect that to them, and then look for that opportunity to make them aware of assistance that they can reach in addressing knowledge. Seem clear enough on? All right, item 2, this is skills related. So item 2 is skills related. The statement is, I use tactics to help me communicate in challenging situations. All right, I use tactics to help me communicate in challenging situations. Additional questions you can ask. Can you describe a specific situation where communication is difficult, right? Or have you experienced similar situations where a tactic or strategy helped? So just a couple suggestions. We can brainstorm for more. But the idea being here, we're looking for, are they aware of skills and strategies that they can use in challenging situations? And are they able to apply those? So very often we have some tips and tricks for communication that we share, right? But, and those are great, but sometimes it can be a little overwhelming, or they didn't really internalize it as that information that they received. This is the opportunity to identify a specific situation and see if we can address it with a kind of focused recommendation for that. So we can discuss those recommendations specific to the situation they're commenting on and brainstorm on what has or hasn't worked in a similar situation. Sometimes they're actually really close to success. They're close to having the solution. They're just a little off in this particular scenario. So again, it is that conversation starter to help them, know how to move forward and improve their rating, their sense of empowerment related to applying skills and strategies. Anybody think of additional questions that you would ask or actions that you would take related to skills and strategies? None? All right, I'm going to ask again on the next question, so start thinking. No. Okay. Item 3, participation. My hearing loss doesn't stop me from taking part in social activities. The wording on this one is intentional, right? It doesn't, so my hearing loss doesn't stop me from taking part in social activities. And then they're going to say, I agree or disagree with that statement, okay? So if they agree with that statement, hearing loss doesn't stop me, so it would be an indication that they're effectively participating. So if they disagree, right? So now it looks like they are struggling a little bit with social participation and what they can do in that situation. Or participating in, and because of the way we've asked about social activities, what usually doesn't come out in this one is their sort of participation in their hearing healthcare journey, because in the research they found that it was a bit more prevalent that when we started talking about participation, that patients started thinking about social participation. And so the questionnaire that emerges a bit more in the hearing healthcare domain than probably in other empowerment research and other empowerment studies where participation is often about participation in healthcare. In our arena, participation starts to be more about social activities. So this question is geared a little bit more towards that. I think the 15 item questionnaire has a little bit more about that participation in kind of healthcare, kind of participation in your own care. So questions to ask here, in what ways do you think your hearing loss is impacting you? And maybe what about your friends and family, right? Okay, back to my dad. If you'd asked him about his hearing loss and how it was impacting social activities, he would have told you not at all. And we would have felt differently. And so obviously there was a discussion that needed to be had with him about the impact it was having on others or the impact he didn't perceive. And of course, you see those patients on the regular, I'm sure. And so again, just it's a kind of a conversation starter and a way to open a dialogue on this point, because once they maybe have either way, whether they've said, I don't have a problem or I have a problem, there's an opportunity to kind of talk about it further. and dig a little deeper, ensuring both that the patient and you as the clinician understand the social and emotional impacts of hearing loss, and that they recognize the impact of their hearing loss and the benefits of taking action here. Okay. All right, item 4, we're looking at control. So item 4 focuses on control, and it's phrased, I can control how I respond to challenges I experience resulting from my hearing loss. All right. And again, this is one of those that is pretty big across empowerment research in all healthcare, is that sense of control, that people want control. I think it's a fair statement. We all want to be in control of our own, lives. Feeling out of control can be a really unsafe sort of difficult state for people to live in. It can make them less likely to be compliant with healthcare recommendations. It can make them, less effective in their treatment and care. So what are those challenges, and what does that look like in your daily life? Might be a question that you can ask, right? So I can control how I respond to challenges. So if they don't feel that is the case, let's look into what are those challenges? What does that look like in their daily life? We need an understanding of when they feel out of control, right? And how do they respond to it, right? Sometimes it is a combination of not only the situation in which they feel out of control and what that situation looks like, but their response to it. Not unlike dealing with things like tinnitus as an example, right? Ringing in the ears is this perception of ringing in the ears is one part of it. Your response to it is probably the bigger part. So this situation that they're in and how they respond, getting a clear understanding of that. And then exploring the underpinnings of those feelings around, that control or lack thereof in a collaborative conversation. So you can explore tools and strategies and things like that. What's driving that out of control feeling? Frustration, embarrassment, fear, right? I remember, working with a patient who had such a strong response to a struggle around telephone use because their company had changed the phone system, and when they made this phone system change, what had been working for them in the past with their hearing solution wasn't working anymore. It didn't seem like there was a good solution for them with this phone system change, and they feared for their job as a result of this. And so their state of mind to be able to kind of work towards a solution, it kind of took us a little bit of getting to the heart of why this was, what the feelings were behind the reaction that they were having, okay? And then lastly, item 5 on that, self-efficacy, right? This one is related to self-efficacy. I'm confident about my ability to manage problems caused by my hearing loss, all right? Little different from the last one, right? So the last one is can I control how I respond to the challenges? So a little bit about the challenge and the response. This one is about the confidence in my ability to manage a problem, okay? So again, this is where we use it as a starter for a conversation, maybe something like, tell me about a situation where you did not feel confident. And again, as a reminder, if their score on the item indicates this is not an area of concern, you don't have to have the deeper conversation for every one of these. It doesn't need to go on and on. You target this. So you use the questionnaire and the rating to decide where we're going to dive deeper and where we're going to have the conversation. It doesn't have to be on every point. So if this is an area of concern based on that scoring, can you tell me a situation where you did not feel confident? And then again, that collaborative problem-solving discussion. An example shared, this isn't it's not my dad for once. An example shared by someone else is a patient who was doing really well with their hearing aid fitting, right? Generally finding success in all kinds of situations that you would hope that hearing aids would help them. Out doing all kinds of things, watching TV at home, generally a really successful fitting. but expressing concern, frustration, and difficulty in an environment where she went to lunch with a friend at the friend's house. And the friend would play some classical music, ambiance, some music for ambiance during the lunch. I don't have friends like this, but this is how ladies lunch, I guess. So they lunch and the music, and apparently the music was a bit loud and disruptive to her actually being able to, the hearing aid wearer being able to communicate in the environment. And of course, your reaction is a little bit, so just ask them to turn the music off. But she didn't have that confidence to do that. She worried, about asking her friend to change this thing that's just always the way it is. You come to lunch, the ladies' lunch, and the music plays, and it's her house, and that would be rude, and I don't think I can ask for that, right? And, you're like, wow, it shouldn't be that hard to just say, turn the music off, right? And so then the conversation had to go into looking at what is the solution to that, and helping this patient see, for example, in this situation, that how do you think your friend would feel if she knew that you sat there for years struggling, not being able to communicate, not enjoying that lunch, or maybe even stopped going simply because the music was too loud? And you could have asked her to turn it down. And the patient gained a different perspective on this, right? Like, oh, yeah, no, she'd probably be really unhappy that I hadn't said anything, that I sat there suffering in this situation, right? So shifting that mindset to that confidence that you can handle the situation that you're in, that you can ask for what you need. It isn't inherent in somebody just because they get to that daily hearing aid wearer part of it. It isn't even inherent just because they have skills and knowledge. She knew she needed the music softer. She knew that either lowering or turning off that music would help her situation. She understood her needs. She didn't have the confidence to ask for them. Right? And so sometimes it can be that last step. So, I'm sorry. Yeah.
What's interesting to me is the majority of the population I've worked with in my practice was 65 plus, and the majority of that even being plus. It's not that they don't know that that is something that, just turn the music down, please, but it's more of that generation
Yeah.
or age and population that
And for the people at home,
not
yeah.
do that.
Yeah,
Because that's not what you do.
right.
That's rude, that's not what you do. So trying to empower someone that is of a certain mindset or generation, and we're not necessarily going to teach those people at this point that you could do that.
Yeah.
You need to feel confident that it's
Yeah.
okay to ask. It's
The-
a generation that will ask and say.
Yeah. But also, too, like, can we think of a way, right? So for the people at home, the comment was, that sometimes our patients of a certain generation, they're not comfortable doing that. They're not going to ask for what they need. And I think you're right. And I think it was eye-opening to me to kind of hear that example, because it seemed like a simple problem with such an easy solution, and yet the patient wasn't asking for it. And so, and I see it myself, when, again, sometimes knowledge, skills, and application of those are two different things, right? I explained to my parents, now that my dad is doing a good job of wearing his hearing aids, we have conversations, but even before that, we'd have conversations about where in the restaurant you should sit. And they won't sometimes ask for the seat that would be, I'm like, why did you accept this table over here when there's that room over there that is quieter, right? You have to ask to be there. And so it's a really big challenge sometimes to get them to move forward with that. And so I think, though, right, is maybe reframing their thinking about it. Like this example with the lady, how would your friend feel if she knew you were unhappy, that you were struggling, that this was such a difficult situation? Or for my parents, right, who won't ask for the seat at the table, right? Is that ask worse than sitting here in silence, not communicating with each other, not being able to hear the specials on the menu because you've ended up in too loud of a situation, or is, kind of, is the juice worth the squeeze, right? Like getting them to move a little bit in that direction of understanding the payoff for them isn't as bad. But you're right, it is sometimes challenging generationally for that. Comments, thoughts? As I keep moving here, we're gonna kind of move away from the questionnaire. Any questions or comments on this kind of thing, applying it, thoughts? I'll pause there. Yes. And I would give you the microphone if I knew how to get it off and then back on. So, sorry, maybe.
Where, at what point are we presenting this questionnaire?
Yeah, throughout. So actually, that'll be, so you've teed up my next slide. So I would suggest that you can use this in many different ways. I certainly think it can be something that you do pre-fitting to kind of establish a starting point. So the question for those at home is, when would we use this questionnaire? Because we've established that this idea of empowerment is a process as well as an end goal, and it isn't static, I would suggest that you can do this throughout the process. So maybe a pre-fitting baseline is established, and then maybe as you reach that, end of that fitting phase and are about to kind of send them into that continuous maintenance post-fitting, we can check again. But it's been suggested and being investigated in some of the research now. What happens when they come back for a checkup at a point in the future? Should we check again? Potentially, because this is not static. Their gains in empowerment, something can change, like my patient with the phone system change, right? And how is whatever's happening in their life right now impacting them, right? All of a sudden somebody's life changes, their children and grandchildren move back in with them. The situation at home is different. We should remeasure. So what is suggested so far is that because it's a quick 5 questionnaire, and if you had a baseline where they scored previously, so they did their agree, disagree scoring, you could just have them do it again, maybe in the waiting room before you even see them. You can look at changes in that scoring and then open up the dialogue and the conversation to the specific item that has potentially shifted. And remember not always to focus on the negative. If things got better somewhere, acknowledge better, right? Because it can help them see the progress that they're making. And if things got worse, we can sort of try to flush that out. Make sense? Okay. And again, remember that this is that collaborative effort, right? So this is where I'm going to switch into and use the rest of the time that we have to talk a little bit about what you can do, right? So if this is a collaborative effort and what we as a clinician can do, when we have those conversations, when we're measuring empowerment, when we're looking for ways to improve, to develop empowerment, what can we do? I loathe the presentation that doesn't give you something you can do on today's Saturday, when you're all in the office tomorrow. No, I'm kidding. Monday, when you're back in the office, what can you do? So let's talk a little bit about some of the things that we have, tools we have at our disposal, things that we can do to help our patients. So there's a lot of tools that we can use to maximize empowerment throughout the hearing journey. There's knowledge and skills that we can help to develop, and I'll share some resources with you related to that. There's apps and AI assistance type of applications. There's accessories and tech. This is where I have to give you a disclaimer. Of course, I do work for Widex. We are a hearing aid manufacturer. I will use Widex examples here because they are readily prevalent and available to me when building a presentation. But what I'm sharing with you largely, you can look at whatever brand you fit on a regular basis, okay? We're gonna talk about knowledge and skills and some things that aren't hearing aid or hearing device or app related. In apps and AI, our industry, every hearing aid has an app. Almost every manufacturer, I think, is applying AI in some way or another, differently, yes. But you have options. So where I share a Widex example, think of the technology that you work with, and then also maybe learn something about the way that WIDEX does it if you're not familiar already. All right. So let's start with knowledge and skills. All right, we're going to focus on this, and this is just a slide. Nope, you did not just enter a nature show here, but what's the old saying, right? Is anybody thinking of the saying, right? Give a man a fish, feed him for a day, teach a man to fish, feed him for a lifetime, right? So when I talk about knowledge acquisition, it is, you cannot possibly teach somebody everything that they need to know in the amount of time that you spend with them. It's been a little while since I've been out of clinical practice myself, but I'm in them a lot. I know how busy you are. I know how busy I was. I know how much information there was to share, and I know how little of it they retain, right? 25% potentially. So we have to use all of the tools that are available to us to try to make learning accessible where and when that patient needs the learning, where and when they need the knowledge, and free from you at times. We are the experts, and they should hear our, they should feel our expertise, like, hear me roar, right? I know it all. You know a lot and you can share a lot. You just don't have the time, and you can't be in their pocket at all times. So use things that are available to you. Many apps today have great tools built into them to help patients help themselves. What you're seeing here is an example of WIDEX's what we call the My Guide. It's an area within the app that has instruction videos, articles, troubleshooting tips, and it helps empower even the not so tech-savvy patient. So some of the items are specific to their devices and recognizes the model of device they have and gives them instructional videos and information about their hearing aid. Some of it is more general, about hearing loss in general, about communication strategies in general. And so, you can really, there's courses so they can go through kind of like learning paths, right? Think, Noom or whatever digital, app you might have engaged with to learn something in sort of a course-driven format. So look for options like that. Make sure that your patient knows that they are there, right? It takes only a couple minutes for you to show somebody who is an app user or a potential app user how to install their app, and then where in that app they can find this information. It can make all the difference for them knowing that they can get access to knowledge when they need it, and prevent those feelings of loss of control, the frustration around maybe not having the knowledge and skills they need when they do.
And how is this information available to those that have no interest in?
Yep, if they have. Yep, absolutely. Not everybody is an app user, and so then I would say look for guides and supporting materials that are available. Many manufacturers provide a lot of guided materials about some of the similar topics, right? So I'm certainly going to acknowledge that I think there's a lot more information, a breadth of information available digitally that is not available in print, just due to practicality, videos and things like that. But look for other sources, YouTube channels. Many manufacturers have YouTube channels with some of the same videos that are app-driven, are YouTube-driven. If they do have a computer, tablet, if they're totally no digital, look at printed materials. We have, I know WIDEX as an example has some good comprehensive brochures, patient guides, and materials that can help walk through the process, and other manufacturers have some of the same. And then look also at what's available outside of just proprietary or product specific from the manufacturer. Other websites and things like that might have information even within your own practice or within your own community. And then I'm going to share one with you that is not digital, and I love it. So one of my favorite things is the book Hearing and Beyond. And I want to fully acknowledge that this is the work of Sherry Eberts and Gail Hannon. They are hearing loss advocates, wearers of hearing aids themselves. If you're on any of the forums and things like that, you might see them presenting. They're unaffiliated with any specific manufacturer, and their work is in patient advocacy and helping patients succeed. They've authored a book, Hear and Beyond. We did a collaborative presentation with them last year, and I'll share a little bit about that. But the idea behind this is, how can you help your patients leave your office with information that can change their hearing journey and put them on that path towards empowerment? This book could be one of those things, or making your patients aware of access to this book. And here's a little bit what's in it. They talk about this three-legged stool of critical skills. They call it mind shifts, technology, and communication game changers. All right, so they kind of bucket everything into these three categories that they share. Now, they are not audiologists. They are hearing aid wearers themselves. They are advocates for people with hearing loss, but they are extremely knowledgeable, both lifetime hearing aid wearers, and for Gail, cochlear implant wearer now, and they are outspoken, and they are connected well within the industry. So this is really good quality information, but it comes from their lifetime of experience and their work with hearing professionals. And so in communication game changers, what they look at is strategies for changing communication, they call it transforming the conversation. And so this looks beyond technology. So this isn't so much about the hearing aid, the accessories, the apps, the things, but various strategies. They call them, they like to call them hearing hacks. So just helping people see that, identify a situation and recognize a strategy that can be applied in that situation. So improving any hearing situation by kind of applying a little formula that they've developed, where they do this hearing check, they evaluate what will improve the situation, they can articulate that. So there's that self-efficacy, there's that I'm going to ask for what I need, and then revise and remind. Did that work? Did that do what I needed it to do? And then adjust as necessary. And the book is full of a lot of examples of these communication situations and the communication hacks. So I think it can help with exactly what was being asked earlier of this, patient or generation of patients potentially who are resistant to the idea that they'll make the ask. Sometimes just seeing enough examples of, here's the situation, here's what you could have done in it, here's what you could have asked for, might, kind of change their position on that. So again, this is all, their work. I have no affiliation with this book or the authors, except that I'm impressed by their work, and I've seen it get adopted in clinics and be successful. So the second leg of their stool is technology, right? Plugging into better hearing. Technology is their friend, right? Devices let them hear, their hearing aids let them hear sound, but what else, right? Other devices, technologies, accessories, things like that, using all the technology. And it's not always just accessories. Is there something that you can use that's more of like a closed caption? Gail Hannon shares a story about using various apps and tools on her phone in a really difficult situation where she's needs some assistance, like on an airplane. And so how she'll approach a airline stewardess and or a flight attendant and ask them to, let them know about her hearing loss, and that she only doesn't need to be told about everything that's happening on the plane, just the really important things like, dangerous things, or something that isn't clear by the visual announcements, and then has an approach for how will she get that information, because she's likely not to be able to hear that individual in that noisy plane situation, even if they come and talk to her. So, how can you use technology? She's got an app she uses for something like this. So, really great examples and stories around that. And then the last one here is mind shifts. So mind shifts is the potential to change your mindset, right? Change your journey and kind of come at things from a new approach. And I'm going to talk a little bit more about this because I want to share some research with you that's really relevant to that shift of mindset. So this is a great tool, and there's the book where you can get information about it. I think it can be something to let your patients know about. Right. So I said I want to talk more about mind shift because I want to talk a little bit about the power of positive thinking. So once, not too long ago, I was talking to a colleague and friend of mine, work colleague, work friend of mine, and I'm sure that I was deep into one of those pity party moments where I was lamenting about all that was wrong in the world, my life, my job, whatever. I don't remember. It isn't even relevant right now. But I commented to her on how she always does such an amazing job of staying positive and just, pushing through these things. And in response to that, she said, "I simply choose happiness." And my initial reaction, I'm sure in that moment was, what do you mean you just choose happiness? Like, that's not real. You don't just choose happiness. But, she got me. She got me thinking about it. And I have to give her the credit for it. Like, she got me to think about it. And I like to walk and listen to podcasts and audiobooks. And so then I went on this little self-help journey around this concept of like choosing happiness and what you can do. And a lot of things you might have heard, like, people gratitude journal. Apparently I struggle with gratitude because that didn't work for me. But what I did find I could do was at the end of my day, I could think of one positive thing that happened. Like, maybe I didn't rear end that car in front of me in that horrible traffic. It was close, but it didn't happen, right? Like, and I mean, I know that is like the least that is so not positive, but I made it a habit every day to come up with one positive thing. And then I found myself thinking through the day, oh, that's my positive thing. I got it already. That's my positive thing for when I write it down tonight. And then sometimes I was like, oh no, this is even better than my earlier positive thing. I have 2 positive things for today, right? And I'm sure that had I not been in that mindset of thinking of the positive thing, I would have ended up at the end of the day, and if you'd said, tell me something good that happened today, I'd have been like, oh, it's a terrible day. Nothing went right. Everything was wrong, blah, 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 right? But I was thinking about it all the way through. I was prepared to give the positive. So apparently I'm not alone. And researchers are interested in this as well, and some of ours. Again, a different group than the ones I highlighted there, but the reference is at the bottom. You'll see it in the work. But I just needed to bring this in because I think it's super interesting. So they've started doing research on the power of positive thinking in hearing care and hearing aid fittings. And so, there's this, and I want to keep us moving, not keep you over, leave time for questions and all of that. But there is this, known negativity bias that this is a psychological phenomenon where negative events are more prominent than positive events, right? I mean, can you immediately think of a terrible experience you had on an airplane, in a restaurant, right? A lot harder to think of a really good, especially when I say airplane. I mean, I fly a lot, so I could keep us up here for 4 hours talking about bad airplane experiences. It's sometimes hard to think of one good one, right? So, and not that airplanes are so terrible, but you just remember the negative, and we know that throughout our lives, right? It's why it's the problem with negative reviews and things of that nature. So in terms of hearing care, what this means is that hearing aid benefits can be overshadowed by difficult experiences, which can negatively influence outcomes, right? So that hearing aid wearer potentially had all kinds of really successful hearing experiences throughout a day, a week, a month, but they are only thinking about the one time that they didn't communicate well. They're not thinking about the positive things that happened. They're focused on that one challenge, that one negative situation. So these researchers have been looking into this. This is the article referenced here is their second or third in a series of them. In a prior study, they had showed that focusing on positive listening experiences improves subjective hearing aid outcomes. So what they did is they fit people, and they've got kind of a pattern here that they follow. They take two groups, they split them up. There's a control group and a test group. They do all the necessary measures to determine that those groups are effectively equal in all the ways that matter for this test. And the control group just wears hearing aids. And the test group wears hearing aids and writes down one positive thing. It's been as easy as send a text. And the control group sends a text with the number of hours they wore the hearing aids that day, and the test group sends a text with the number of hours they wore the hearing aids that day and one positive experience. And the test group is subjectively more happier with their hearing aids, has better outcomes on subjective measures. So then they went on to look more objectively. Can it actually impact outcomes, how the hearing aid works for them? So they redid that kind of study, focusing on positive listening experiences, but then measuring speech intelligibility throughout the test. And so the primary aim of the study was to investigate whether focusing on and sharing positive listening experiences in everyday life can improve speech intelligibility in noise. Can you actually perform better? I'm sorry, that's so small. And I also left the house yesterday when I came here with the wrong glasses, the ones that I cannot see small print with. So anyway, I think it just says exactly what I said before. If you think I've been reading, I can't see anything on this screen because I didn't bring the ones that have the transitions. I don't know what happened. I brought my wrong glasses. So I'm just sort of aware of what's on the screen. It's the format that I described. So they split into two groups. They get fit with hearing aids. They get a speech and noise test. They use two different types of speech and noise tests because some of the subjects were studied in Denmark, so Danish speaking test, and then the hint for the English speaking test at another location. So they do that at the hearing aid fitting, and then they repeat that at a later point, 2 weeks, when they have been doing that, and the control group has just been wearing the hearing aids, and the test group has been keeping track of a positive experience. Okay, and what ultimately is found is, if you can see, I'm going to peek out here. Yes. Okay. The dotted line is the positive focus group. So that's the one that improves in terms of speech recognition threshold in noise. So that SRT, recognition in noise test. So that speech recognition in noise threshold there at 2-week period, you see that going down on the graph. And the control group either sort of stays the same or not significantly improved. So all the differences between those two groups is the test group, the dotted line, focused on positive experiences during that period of time and then came in for their test. So what their conclusions are from this very early study, they're continuing on this path, very much like empowerment. This area of positive thinking is a focus area for the study. So the current study showed that focusing on and sharing positive experiences improves speech and noise performance in experienced hearing aid wearers. These are experienced hearing aid wearers. More good listening experiences were reported at the exit interview. So when the control group and the test group ended the trial and were asked about their experience with hearing aids, the test group, who'd been tracking those positive experiences, had positive things to say about the hearing aids that they were fitted with and used. It does, so, you can see the potentially this impacts hearing aid outcomes overall. So these results point to the importance of adopting that positive focus approach. Can we get our patients to think of something positive, right? Instead of always the negative. Sometimes we set them up for it too. They come in and we're like, how's it going? Any problems? Right? When we send them out, we say, if you run into any problems, make a note of it. right? And then we'll talk about it when you come in for your follow-up appointment. We just ask them to focus on the negative, right? So instead, focus on the positive, because it can create positive outcomes. And it's as simple as a notebook. So maybe, an idea, run over to the local office supply store, your big box store in your neighborhood if you frequent that one. Get some pads of little notebooks that are not expensive, and give them to your patient and say, every day, I'd like you to write down the number of hours that you wore the hearing aid. I know we largely don't need to do that anymore because of data logging, but it gives them a task to do. The number of hours that you wore the hearing aid, and one positive thing that happened. Because also, if you're asking them to write down one positive thing, they have to wear the hearing aids, or they won't have anything positive, and they won't be able to do their homework. So, something that small could change the outcome. More studies need to be done, larger N's, different parameters, but it's an indicator that there's an importance in focusing on the positive. All right, moving on. So that was knowledge and skills. Think about apps, think about resources that you have available to you, think about books that you can recommend, and think about just putting them in the mindset of positive thinking, because it's going to make them feel more in control, and that they have that self-efficacy is going to improve. If they come in with a notebook full of thoughts about positive experiences, it gives you an opportunity to point out to them the number of times they're being successful. Even when they're dealing with some challenging and frustrating situations. And it can help give you the answers to what they do that is successful versus and provide an insight to what might be failing when they're challenged or not successful. So it can also be the guidebook for continuing to have those conversations. All right, apps and AI assistants. There's a lot of AI and a lot of app available to us, and I know it's not every patient. That's fair. My dad has a smartphone. Mostly it can't recognize his face or his fingerprint, and he can't type in the numbers, but so he's not a super app guy. He can do it when he needs to. It's not exactly his thing, but yet, many of our patients are adept at learning the apps, and then there's and using that AI technology that might be available to them within apps. So there was a practice owner that I was working with once not long ago, and I thought he said something really insightful on this subject, and he was talking to the hearing care professionals in the practice working for him, when he said, don't be the gatekeeper of information, right? Don't be the barrier. He's like, make them aware of what their options are and help them determine what's available to them. Don't make that decision on their behalf. And it reminded me of back when I used to be in a position where I was in the field working with customers in the clinic for a hearing aid manufacturer, and doing a customer event. And I looked at a patient who would come in for this customer event, and based on age and appearance, I decided he was not an app user. I just decided for him, right? I was in Iowa. He was wearing overalls. He looked like he just, rolled in. He didn't even bring his phone in to the meeting or to the event. And I was working with somebody next to him talking about the app and how they could use it and all of that. And he got up and left, and I wasn't sure where he was going. And then he came back shortly after with his phone, iPhone, one of the newest ones at the time. And so and he says, yeah, tell me again. I go here, and there to get to the app. Yeah, that's exactly. He just was looking over the shoulder. He picked up on all of it. He was a tech savvy guy. And I misjudged him, right? He was a farmer. I wasn't wrong about that. He also has a multi-million-dollar combine with a big piece of equipment in it that is probably more sophisticated than the computer that I'm operating on today. So, I share that misstep on my part, to say, we can all end up doing that sometimes. And so, let's try to expose patients to what's available to them. It's just a little bit of market track results over the past 7 years, the increase in smartphone usage, the increase in app usage, the increase in technology like TV streamers and companion microphones and things like that, all increasing, right? Our patients are more and more open to using various types of technologies. So let's be sure that we're, offering them that option when appropriate. Maybe not everything at the first fitting, I'm with you on that one, but not withholding it from them because we think they don't want it or can't do it. There's a satisfaction that can be achieved when additional tools are utilized, okay? And again, some information on that, but I'll keep moving. And I'm going to go through some of this really quick because there's a few parts of it that are just really specific to Widex. And while I love Widex and I love to share Widex, I do want us to end on time. And, it's not my intent to give you a sales presentation up here, but rather to share as an example of what, you might look for and try to share with your patients when you have the opportunity. So advanced technology is available in many hearing aids today throughout the industry for customizing experiences that our patients have. Leveraging artificial intelligence, right? So that ability that a computer has to mimic the problem solving and decision-making capabilities of the human brain, right? Doing a bunch of kind of calculations and decision-making that focuses on arriving quickly at an answer and modeling a little bit the way that humans learn, right? That machine learning aspect. So gradually improving. So this technology, I would say, is pretty prevalent throughout the industry. In some cases, what is referred to as AI and machine learning types of capabilities as more automatic things. So training systems to perform a certain way, automatically requiring nothing from the wearer, and then other times looking at systems that are more user-driven. So looking at, what happens when in an environment there is the need to do something other than what the hearing aid system automatically concluded was right for that environment, that wearer in that situation. So tools that are available there are more app-driven. For Widex, it's something like the MySound real-time machine learning that allows a wearer interaction through the app to change their experience in the situation that they're in. Whatever the technology is that you're engaging with, I think the thought process here and on that empowerment mindset is how do we help wearers solve the problem while they're in it? How do we ensure they have the knowledge, the skills, the tools, the technology to solve the problem in the situation that they're in while they're in it, rather than it being something they're talking to you about, next week back in the office or next month or in 6 months at their checkup, having had all of these situations where things did not go well for them, potentially. So looking at how do we solve the problem while we're in it, because that's going to foster that feeling of control, that feeling that my actions, my behavior can influence the outcome of a situation. So it helps us with that empowerment. Otherwise, what we're dealing with are feelings of frustration and annoyance, back and forth visits and sessions, and for you, potentially lost professional time, revenue, if that's the structure of your office, that those appointments cost money. Whereas AI and using apps and tools can address this both for the wearer and for the hearing care provider. So, for Widex, something that we've long had as part of our technology is this machine learning, and it just provides a path to customizing in the moment. It's called MySound. You can look it up a bit more if you're interested. It's based on a lot of machine learning cloud data that's been gathered over many years since it was first launched, and tries to provide some insights where we're able to see kind of general user preferences, is so that we can guide some initial recommendations for a patient and then still give in within the app. So when they tell us where they're at, what's wrong, they can get a recommendation. One of those recommendations might likely work for them. And if not, they can go on and do a greater type of real-time customization for them. The recommendations are super easy. Almost anyone who uses a smartphone and can launch an app can do that. A little bit more tech savvy to go in and complete a series of comparisons to arrive at something more fine-tuned. So that's a little bit specific to Widex. Throughout a lot of apps, though, you have many fine-tuning options with volume control equalizers, sound mixers, things of that nature. So, when you're maybe checking in with patients on that empowerment questionnaire and uncovering some of those potential challenges that they're experiencing, is something like this the solution for them? Is an app where they can do some fine-tuning the solution, and we just didn't introduce it because we maybe thought they didn't need it? Didn't want it. Maybe they even said they didn't want it, but remember how empowerment is not static? Neither are the patients. They might evolve to wanting something they initially said they didn't want. Streaming controls can be useful as well. So again, look for that technology available within the devices that you're fitting, within the apps that go with those devices, or even within the native controls for iPhone and Android. Those are improving all of the time. And sometimes, while not as full-featured as an app, built into the system that they have potentially today. All right, accessories and other technology, right? So, globally, more than 2.5 billion people need one or more assistive products, according to the World Health Organization. That's not just in hearing, like assistive products. But with aging, the global population and a rise in non-communicable diseases, so we're living longer, then that number is rising, right? We need assistance. We need help. You're going to be shocked. I'm going to go back to my dad. Even outside with his hearing aids, he uses a lot of assistive technology. You're going to see some examples of that shared here. But in the rest of his life, right, he's a diabetic with some other chronic health conditions. So there's accommodations in the house. There's assistive technology he needs in his house to be able to shower and toilet and take care of himself, right? We don't think twice about those things being necessary. So we should definitely think about the technology that can help our hearing aid patients as well. So thinking about what we can do there to support that end user empowerment and look at accessories, utilizing some intake type of forms, whether you're doing maybe a cozy, this is the hearing handicap inventory. So, whatever your choice, the MPAC that I showed you earlier, that 5-question that combines empowerment and discovering needs kind of piques your interest. There's not probably a wrong answer to this suggestion that we use something to kind of help find get that relevant information pertaining to the impact of hearing loss on this individual and what are their needs. And then consider all the available options without assuming that somebody won't be able to utilize it. And the options are broad, from TV streamers to remote mics to computer streaming devices. There's a lot that is on the table, with the technology that is available to you today across manufacturers. And then think about making those recommendations early in the process. You may not do this at the fitting. You may not, dispense it immediately, but sometimes just mentioning that you think this could be an option for them in the future opens the door to it so that it sounds like part of it is, not just sounds like, it is part of your professional recommendation at the onset, as opposed to potentially coming across feeling like another thing you're selling them. later, that now they feel like, but I just bought these hearing aids and now I got to buy this other thing, right? That difference of, I told you at the beginning that I thought you would need this, and now we have confirmed that you need this, right? So let's move forward with that. So look for the tools that are available. It can be as simple as getting a good brochure from your manufacturer about some of these products, and letting them know, I'm giving you some information about something that we're going to talk about when you come back in 2 weeks or 1 month, because I think you might need this. It's not for today, but for next month. They might read it, come back knowledgeable and ready to have that conversation down the road. Okay, so just again, my plea to, find what you like. The HHIA inventory is a good one. I think there's a shorter and, I'm not sure which one is here because I can't see it. But there's short forms of that one, different versions of it. The MPAC I've showed you here, Cozy is great. Try to utilize something and then think about the technology that you would recommend based on that. And again, think across the board. This is just, again, an example of WideX technology, which is everything from a remote control that can help people who aren't app users or don't have a smartphone to control their device, all the way to a multifunction streaming device and remote microphone device, TV streamers, different phone options, sometimes making the difference. So again, you guys are going to be shocked. I swear I do fit other people than my dad. He's just my favorite patient. So get me in a different situation and a cocktail. I'll tell you about my other brother-in-law. No. So my dad. One of the things that made a total difference for him was recognizing how much time he was spending streaming from his computer. He's a digital photographer. He likes to watch videos about all kinds of digital photography. He's totally into AI generated photography right now, and he watches tons of videos about it. And he couldn't hear them very well. And I was able to get a device that helps him stream from his hearing aid, from his computer to his hearing aids. Super simple, easy to use. He loves it. It is literally the thing that made him finally keep the hearing aids in his ears. Honestly, sometimes discovering that need. Now he puts them in the morning. He wears them all day because he likes to have them in to do all his streaming. And as a happy byproduct of that, he can also hear us when we're talking to him in the house and around the kitchen table, and he's participating more. But he never would have gotten up and gone and put his hearing aids in just for that, because you couldn't have convinced him that he actually wanted to hear my mother. So there. Again, now we're really close to time, and I'm going to wrap up here, so I'm not going to go into the details. Also, I know a colleague of mine dug really deep into this research at this event last year, and I'm sure you all remember it from last year. But to be fair, think about remote microphone systems. They can be really significant in the success of a wearer when they need it in that situation. I know it's an extra thing, sometimes a little challenging to get them up and going with it, an added cost, but you can sometimes find a low-cost option like this from WideX. It does a lot of different things, but mainly what it's going to do is offer that partner mic and table mic option, really easy to use and with really amazing performance, getting up to a 20 dB signal-to-noise ratio improvement for an individual in that noisy environment when it's positioned close to the talker in that partner mic mode, and even at a greater distance, an 11 dB. That's better than any directional microphone system is going to be able to do for you, so use it when you need it. And table mic performance can also be really important for changing that situation in group conversations. And again, even at some of those greater distances of the talkers from the microphone, 6 dB SNR, that can be, again, a really significant improvement. Okay, there's that little streamer that made all the world of difference for my dad. So it's, again, just saying, think about what's there for you in that technology, and think about it across the whole journey, because needs change, right? All of a sudden somebody has a new hobby, they have a new interest, and post-fitting, they need something they didn't need at the start. And keep our eyes on how do we facilitate empowerment across all of these dimensions, because it results in better health outcomes. And with the research that we're doing now, some really large-scale studies using these empowerment questionnaires, I think you're going to start to see how we can measure and show the benefit of empowerment in these hearing health outcomes in the future and in future publications. And so you're a partner with your patient, and our goal is to move them to that empowerment, and I'm certain that we can, and get better outcomes from their hearing aids, better outcomes from their hearing healthcare. All right, so thank you. My email address there, if I've said something egregiously wrong, you may email me. If I said something you really enjoyed, I'd even love more to hear from you. And then I will leave the references up here if anybody is looking for a snapshot of that. And I said I would share slides. Probably what you won't see in my slides is all of the stuff from Sherry Eberts and Gail Hannon on Here and Beyond, except for the book link. While I work collaboratively with them and have their permission to share it with you, I don't distribute it. It's their work, not mine. All right, thank you very much. Appreciate your time. And we have just a couple minutes for questions, and I know you need to go to the bathroom before our next speaker, so it's okay if you just jump up and run. But questions? Yes? I can try to. Oh,
You know, overall, client satisfaction has significantly improved in the last few years as the hearing aid technology improving, like signal processing, noise reduction, app use, fine-tuning, Bluetooth technology. You know, however, we don't see every single client with mild to moderate level, sensory neural hearing loss, easiest clients. At the same time, 1 or 2 in every, 5 clients, we have various scenarios, mixed hearing loss, asymmetric hearing loss, precipitous hearing loss, retrocochlear pathologies, single-sided deafness, you name a thing. So, setting expectations is part of empowerment or not?
Yeah, I think, I'll have to say it's not, it wasn't part of the studies here, but yes, I think that you have to I think setting expectations is always part of that, that hearing healthcare journey. In empowerment specifically, right, it's that part, it links to, and I think if we go back to the original interview, the paper on the original interviews that they did was pretty lengthy because it details, and there's appendices that detail pretty much all of the responses from subjects in that. And I believe it is in some of those responses where you see a little bit of what you're talking about. So when we look at elements around control, that feeling that they know what to do, that their behavior has an outcome, it is a lot about expectations. Do they understand, kind of what to expect in the long run and what their behavior, what behavior they have that can influence the outcomes, can give them that that sense of control. So I think that one can be quite related to setting good expectations up front in order to achieve that feeling of control in the end. If we promise them the world and then they don't experience it, right, that's going to contribute to that lack of a sense of control, because their expectation is, I should be doing better than this. So I'm feeling like I don't have control now. It's a good question.
Thank you for such a great presentation. I really loved the positivity section and how important that is. I remember in my profession asking patients on follow-up to start with. So let me hear one good thing that before we get any further, tell me one positive thing that you noticed in this last week or so. One of the things, though, I want to mention and focus on, we talk about the word empowerment is according to me, new word. Like in my life with adult children, that presented me, that introduced me to boundaries at 65 years old, like boundaries. Mom, it's okay to set boundaries. So another word that generationally I think people need to learn. And I think it starts, I think there has to be a section that's called pre-fitting, because all the terms used about what empowerment is has to do with, I wrote down confidence, control, independence, decision-making. So where does that start before that pre-fitting when a person is first starting to notice hearing loss, and where can they get their information and feel like they can become empowered at that point to lead them into our office? How many times I remember having patients come in because the children brought them in, and it was an unsuccessful journey with them because they were not the ones that made the decision to be there. I personally think a great start out there, which I always felt challenged with, is by the physicians, which just doesn't happen because they're trusted usually by the patient, number one, before we even come into the picture. So that's my comment. Question.
Can I comment on that and then end? Because, then we have to end. So it's a great statement, and I think that one of the greatest things that I've seen is just an increasing awareness of hearing loss, hearing and solutions. Wherever you stand on the position of OTC, there's one thing that's true is it's increased awareness of hearing loss, and so among a population. So that's, the silver lining on that. I think one thing, you're totally right. I think there's concerns about maybe how people respond to language that we use. Empowerment may not be what they think is the goal in hearing healthcare or healthcare overall. That might be unfamiliar to them. What's interesting is we probably don't have to say it, but we can do it. So we can facilitate it without telling them that we're facilitating empowerment. Even a questionnaire like that, just take off the header that I think it says MPAC on the questionnaire, and don't worry about getting bogged down with something like how do they respond to the idea of empowerment, and the questions themselves are rather situational hearing loss related. Okay, and I'll end to respect time for our next speaker. So, but I'll be here if you have some questions, burning questions. Thank you so much.